98.1 KZE, good afternoon and welcome back. This is Will with you here. My guest this afternoon, Dr. Button from Astor Services for Children and Families. They've got a number of locations, a lot of services and ways that they're involved in our local community. You can visit astorservices.org. We'll get you really details, get you sort of started on what Astor is all about. Dr. Button, welcome to the program. Thanks for coming in and hanging out with us.
Well, thanks for having me, Will.
One of the focuses of our conversation today is, I think for those who are unaware, this is a big deal. This is a Mental Health Awareness Month we are in now here in May. Can you talk a little bit about sort of where that idea comes from?
Sure. Astor is teaming up with Mental Health America for Mental Health Awareness Month. It's really a month that's dedicated to helping remove stigma that's associated with behavioral and emotional difficulties. And today actually is Children's Mental Health Awareness Day. And Astor Services are really, we serve many children, over 6,000 a year in the Hudson Valley and the Bronx area. And we treat and educate youth who have emotional and behavioral difficulties. And we're really here working with Mental Health America to take that stigma away, to encourage people that if they see a child who's struggling, to seek help, to seek screening, and to call someone and get some services for your child or for your student.
You really segued quite expertly into sort of talking about what Astor does, and I realized I kind of wanted to back up and sort of frame this conversation a little better. We talk sort of about the history just briefly of Astor and sort of how Astor started and what Astor's mission is?
Certainly. Astor started as a small program for children from New York City, a residential program in 1953 in Rhinebeck, New York. And over these 60 some odd years, we have expanded working with local municipalities, the State Department of Education, and the Office of Early Childhood Education to provide many different kinds of services across many regions.
Can we touch on just maybe a little bit of what some of those services are? Because you've got the Astor Services for Children and Families. There's a lot of stuff that you guys do, as I understand
Absolutely. We provide early childhood Headstart services in Dutchess County. So that's 0 to 3 and 3 to 5. We have preventive services for little kids. We have education services, day treatment for school-age children, adolescents, middle school-age children. We have residential treatment centers, partial hospitalization programs, and we have multiple outpatient mental health clinics for children and teenagers across Dutchess County and in the Bronx.
You mentioned the Head Start element. That's something that's really interesting to me because it seems like the science is sort of in. Like this early childhood stuff is hugely important, and there's no point in really debating it anymore. It should just be sort of a given as something that we care about as a society.
Absolutely. We now know that early recognition of developmental delays and early intervention with youth has a long-term gain in terms of how people function in society, cost to the taxpayer, how people turn out as productive young adults.
Sort of being on the sidelines of this discussion or, not being involved in it, obviously like you are on a daily basis, it does seem like there has been sort of a little bit of a turning point with the awareness of mental health and sort of destigmatizing mental health issues, right? It seems like people are starting to.
But what we really find at Astor in many of our programs is that particularly with children, that stigma is still present, that people may wait until problems with youth become a little too severe. We know this early recognition, really, if you get a child screened and get them treated early, a lot of these problems can be fixed fairly readily with the appropriate treatment. But sometimes people worry. They don't want their child labeled. They don't want to reach out to a student they worry might be depressed or suicidal. So we're still working to sort of take that increased awareness and turn it into early recognition and action.
Here's what's encouraging to me. I have seen, it seems like there's this growing discussion. I'm a big sports fan, and it seems like athletes, there are been some prominent athletes over the last few years who have started getting involved in this discussion. I think typically, right, for men, this is something that sort of, it's seen as a sign of weakness, a lack of masculinity. So now you have these sort of icons of masculinity who are starting to have these open discussions about mental health struggles.
And that really helps, right? Particularly for boys and teenage boys who don't like to admit their own vulnerability. These public figures coming out and talking about their struggles can really help.
Yeah.
The other thing that can really help is important adults in a child's life reaching out.
Yeah.
It's really shocking to some people to find out that the third leading cause of death in children over the age of 10 in our country is suicide right now, Will. And so we want to tell
that's
people...
unbelievably shocking.
It's very shocking. Most people think of that as an adult's problem, right? But what we know is that significant adults, teachers, mentors, educators, parents, grandparents, if they reach out to their kids because they think their kids are struggling, that can make that huge difference.
I think that many of us have probably been in a situation where there was someone who we were mentoring, someone who looked up to us, who we were concerned about them, and you kind of feel like, maybe I'm not the parent, maybe this isn't my... It's scary thinking about trying to have that talk with someone. Do you have any advice for someone who is sort of debating whether or not they should get involved?
I absolutely do. I think one of the most important things to know is that reaching out and naming a concern can't make things worse. The research shows us that actually saying, hey, you seem sad today, or I've noticed you've been really angry for a couple of weeks, that really doesn't hurt. That actually helps kids talk about their feelings, and it helps kids get treatment, right?
Yeah.
So it really is just saying very simply to a child, hey, what's going on? Or maybe saying to a child, you seem really frustrated since your parents got divorced. Lots of kids feel that way.
Yeah. My guest this afternoon, Dr. Button from Astor Services for Children and Families. To see what Astor is all about, you can visit astorservices.org. Do you folks have anything sort of going on that you'd like to talk about here for this? Again, we're speaking about Mental Health Awareness Month. Today is Child Mental Health Awareness Day, which is kind of the focus of our conversation. Is there anything you'd kind of like to spotlight that Astor's working on specifically?
I would. I really want to spotlight early recognition and screening. At any one of our outpatient clinics, folks can walk in, open access, no appointment necessary, with any child between the ages of 3 and 21 and get a quick screening if they're worried about their child.
Okay.
Go to our website. All of our outpatient clinic locations are listed there, or call the main number, or contact Sonia Barnes-Moorhead at the foundation to get more information about that program.
I'm guessing you go to astorservices.org and then possibly under the resources link?
Exactly.
Okay. So that's really neat. And that's something that, hopefully people find that is accessible and people will take you guys up on that. Can I ask what the traffic is like? Like how many people do you see on a...
Oh my goodness. We in a busy month, we can see several hundred children come through the door for screening, intake, assessment. Over a year, we serve over 4 counties, about 6,000 children and their families. So pretty good traffic across the region. Yeah,
and I really like kind of the point that you made about this isn't going to cause any harm.
It's not going to cause any harm.
Even if you're more concerned than you need to be, it's better to be concerned and to take action than to assume that someone else will handle the problem.
It truly is. And it's important to know that 17% of children in America have some sort of emotional or behavioral struggle during their childhood. So some child or teen may be struggling. So if you suspect it, please reach out. If you're worried about your own child, please contact Astor for that screening program.
Well, Dr. Button, I want to thank you so much for the work that you do and for taking the time to chat with us. Dr. Button of Astor Services for Children and Families. Visit astorservices.org. We'll get you all the details on what these fine folks are doing. In particular, we've mentioned the resources link from astorservices.org. Some really helpful stuff there. Dr. Button, thanks for coming in and thanks for the work that you do and spending some time with us.
Well, thank you for having us. Well, we really appreciate the time.
Well, it's our pleasure. It's 98.1 KZE.